Okay, so what percentage of minorities are currently without health insurance? My name is Dr. Erica Steele. I'm a holistic doctor in family practice. I have 6 degrees in my field and I'm a drugless doctor. So according to recent data, about 18% of African Americans and 31% of Hispanics currently do not have health insurance, and that's compared to only 8% of non-Hispanic whites. Lack of health insurance can lead to reduced access to healthcare and poor health outcomes, so it's really important to work towards increasing access to affordable healthcare for all. Moreover, minorities are more likely to be uninsured than non-minorities, which can result in that limited access, especially because of the higher healthcare cost and poorer health outcomes. According to recent data, about 18% of those African Americans and 31% do not have health insurance, as we talked about, compared to the 18% of non-Hispanic whites. One of the reasons that these health disparities actually exist in health insurance is that minorities are more likely to work in jobs that don't offer health care benefits. For instance, African Americans and Hispanics are more likely to work in a lower wage job or work with jobs that don't provide benefits such as health care. Additionally, there's a lot of language barriers, immigration status, as well as a lack of education, which can also contribute to a lack of health insurance coverage among minorities. Lack of health insurance can lead to delayed treatments, untreated illnesses, as well as missed preventative care. This can result in more severe health conditions, higher healthcare costs, and then again, reduced productivity, especially when it comes to healthcare in general. Moreover, minorities are more likely to rely on emergency room services or urgent care for their healthcare needs, which often is much more expensive and less effective than preventative, long-lasting care. So what do? How do we create better outcomes? We address these by the lack of healthcare insurance coverages that can be given throughout. Several initiatives have been implemented, such as expanding Medicare coverage, Medicaid coverage, providing subsidies for healthcare insurance, and increasing funding for community health centers. By working towards increasing access to affordable healthcare for all, we can address healthcare disparities and promote health equity. However, it doesn't really address the fact that a lot of the healthcare model systems really aren't working, especially for minorities. When you think about it, when you go and you're continuing to go again and again, and you're being medically gaslit, you're not actually getting the care that you need, and you're definitely not getting the results that you need, it's very difficult to then want to pay for a service that really doesn't align with your goals, your vision, and really your cultural standards. There are a lot of different opportunities that are really popping up, like pay-per-fee services, like I'm a concierge doctor, for instance. One of the reasons that I became a concierge doctor was so that I could be a private doctor, so that I could really treat my patients as I saw fit, rather than depending on, let's say, a health insurance model and really having a health insurance company in between me and the patient. Now, with that being said, there is a purpose for health insurance. Is really created to affect if, let's say, you have a catastrophic emergency, like God forbid, a car accident or a major accident. Those are really what your health insurance is there for, so that you don't actually lose your home or you lose your assets as a result of some medical trauma. Your preventative care really is about you taking personal responsibility for your health. That means learning about your nutrition, learning about your mental health, learning about your emotional health, which in my opinion is really where holistic medicine is the strongest. So while health insurance is really important and definitely a need, there are some other options that are available that are less cost prohibitive. If we as individuals and minorities learn how to care for ourselves, then ultimately our dependency on health insurance and the healthcare system and the healthcare model goes down. So it's really up to us individually to take personal responsibility for our health and be proactive instead of reactive for our healthcare. So thank you guys so much for tuning in. I look forward to educating you more this month about minority health.